Welcome to the nursing in-servicing video for Aggrastat, tirofiban hydrochloride injection. This video is intended to provide education for healthcare professionals. Please see the full prescribing information. The objectives of this video are 1. The indication, 2. The mechanism of action, 3. Proper and safe dosing for Aggrastat, and 4. Important safety information. Indication. Aggrastat is indicated to reduce the rate of thrombotic cardiovascular events, including the combined endpoint of death, myocardial infarction, or refractory ischemia or repeat cardiac procedure in patients with non-ST elevation acute coronary syndrome. The recommended regimen for Aggrastat is the high-dose bolus, or HDB. In clinical studies with the HDB regimen, Aggrastat was administered in combination with aspirin, clopidogrel, and heparin or bivalirudin to over 8,000 patients in the setting of PCI. Mechanism of action. Aggrastat is a reversible antagonist of fibrinogen that binds to the glycoprotein or GP2B3A receptor, thereby blocking the final common pathway to platelet aggregation. Aggrastat's competitive removal of already bound fibrinogen can result in disaggregation of a newly formed thrombus. The high-dose bolus regimen achieves greater than 90% inhibition of platelet aggregation within 10 minutes. Platelet inhibition is reversible following cessation of the infusion. Following discontinuation, platelet aggregation returns to near baseline between 4 and 8 hours in approximately 90% of patients. Proper and safe dosing. Aggrastat is to be administered in combination with heparin. Calculate the creatinine clearance using actual body weight in kilograms with the Cockcroft-Gault equation. Administer the intravenous bolus dose of 25 micrograms per kilogram within 5 minutes, followed by the maintenance infusion of 0.15 micrograms per kilogram per minute for up to 18 hours. In patients with the creatinine clearance of less than or equal to 60 milliliters per minute, administer the 25 microgram per kilogram bolus within 5 minutes, but followed by a reduced infusion of 0.075 micrograms per kilogram per minute. Aggrastat is removed by hemodialysis. Aggrastat is available in 2 concentrations. The 15 milliliter bolus vial has a concentration of 250 micrograms of tirofiban per milliliter, while the 100 milliliter vial has a concentration of 50 micrograms of tirofiban per milliliter. Both formats are sterile, premixed solutions made isoosmotic with 0.9% sodium chloride. The product shelf life is 36 months and refrigeration is not required. Aggrastat is to be protected from light during storage and should only be removed from the carton once ready to be used. The product is stable outside of the carton in standard lighting for 5 days and therefore does not need to be covered during administration. Step 1. Administer the bolus dose. To open, remove the vial from the light protective carton. Discard the product if any leaks are found or if sterility is suspect. Do not use unless the solution is clear and the seal is intact. Withdraw the bolus from the 15 milliliter vial into a syringe. Do not dilute. Administer the bolus by IV push within 5 minutes. The volume of the bolus dose can be calculated using the following formula. Step 2. Administer the maintenance infusion. Immediately following the bolus dose, administer the maintenance infusion from the 100 milliliter vial by IV pump. To open, remove the vial from the light protective carton. Discard the product if there are any leaks or if sterility is suspect. The solution should be clear with no particulate matter. Ensure the seal is intact. Place the vial on a flat surface. Insert a vented administration kit into the vial. Alternatively, a universal set with the vent open can be used. Pull the plastic hanger from the vial label and invert to hang. The rate of the maintenance infusion can be calculated using the following formula. Administration considerations. The following list of drugs may be administered in the same IV line as Aggrastat. Do not administer Aggrastat through the same IV line as diazepam. Do not add other drugs into the vial. Discard any unused portions left in the bolus and infusion vial. Ensure a vented IV set is used for administration using the 100 milliliter vial. Important safety information. Aggrastat is contraindicated in patients with a known hypersensitivity to any component of Aggrastat, a history of thrombocytopenia following prior exposure to Aggrastat, active internal bleeding or a history of bleeding diathesis, major surgical procedure, or severe physical trauma within the previous month. Warnings and precautions with Aggrastat include a general risk of bleeding and thrombocytopenia. Bleeding is the most common complication encountered during therapy with Aggrastat. Most bleeding occurs at the arterial access site for cardiac catheterization. It is important to minimize the use of traumatic or potentially traumatic procedures, such as arterial and venous punctures, intramuscular injections, and nasotracheal intubation. If bleeding cannot be controlled, discontinue Aggrastat. Profound thrombocytopenia has been reported with Aggrastat. Monitor platelet counts beginning 6 hours after treatment initiation and daily thereafter. If platelet count decreases to less than 90,000 per microliter, monitor platelet counts to exclude pseudothrombocytopenia. If thrombocytopenia has been confirmed, discontinue Aggrastat and heparin. Previous exposure to GPIs may increase the risk of developing thrombocytopenia. Bleeding is the most commonly reported adverse reaction with Aggrastat. Co-administration of antiplatelet agents, thrombolytics, heparin, and aspirin increases the risk of bleeding. This concludes the nursing in-servicing video for Aggrastat. On behalf of Medicure, we would like to thank you for watching. We are here to help and can provide comprehensive education to ensure the transition to Aggrastat is smooth. Please contact Medicure if you have any questions or comments related to Aggrastat, or if you have any questions regarding the use of calibrated intravenous pumps for the administration of Aggrastat.